These are some common mistakes when setting teeth, especially with different skeletal classes, like 2 or 3. So this one, if you look at it, is actually a class 3. So the lower jaw is in front of the upper. The natural inclination is to set the teeth class 1, but not every patient can tolerate that. When we set the teeth for these, it's best to have the teeth over the ridge where they naturally were. So for the mandible, we'll pull the teeth over the ridge like this. We don't want to crowd the tongue or crowd the cheek. So we try our best to keep this over the ridge, then we'll set the upper. This as well, we try to keep this as best we can over the ridge. You don't want to have it too far buccal or lingual. Just try to keep it right where the natural teeth were. And then once we get that, we look at them together. We say, okay, well, this is not ideal. Sometimes we can give them more like an end-to-end setup. So maybe we can do something like this. Class 1, the posterior, maybe slight crossbite. We can lock these, undo the anteriors, bring them down a little bit. Now we have a gap here. We want to close this. So sometimes you may move the anteriors over just a little bit, these back a hair, maybe get them in an end-to-end relationship. But if you try to stretch this too far, try to bring these maxillary teeth over the lower anteriors for a class 1 setup, this shelf up here is too great. It would be very uncomfortable. It would cause issues with their lips trying to close. Or if we tried to move the mandible, look at the pre-op for instance, if we move the mandible back to get a class 1 setup, this would crowd the tongue way too much. It'd be uncomfortable. So it's very important when you're doing these cases to make sure that your teeth are set over the ridge. This is your baseline to make sure that the patient's going to be comfortable. And from there, we try to make tweaks to get the best tooth relationship we can from that. These are some pointers to keep in mind. Thanks.